Hi there, Bobby here with Bodywork by Bobby Wellness Center, and today I am going to answer and go into more detail of the 5 questions you should ask when shopping for a massage therapist. So the first one, what type of massage education do you have? Are you licensed and or certified? How many years have you been practicing? What type of clients do you typically work with? And what is your philosophy when it comes to massage therapy? So these are all great questions to ask. I want to go into a little bit more detail on those questions. So first question you should ask, what type of massage education do you have? Well, myself, so I'm going to answer all these. I have a sports and medical background in massage therapy. I went to a medical massage school. I was originally licensed in Florida, which is one of the hardest states to actually get your license in. My education beyond the 600 hours, I took additional CEUs. I can't even actually count how many CEU hours I have at this point. I also took classes in exercise science, nutrition, and personal training. So that would be how I answer that question. Question number 2, when shopping for a massage therapist. I actually think this question, especially in California, is more important than question 1, and it is, are you licensed and or certified? So the answer to that question for myself is yes, absolutely. I would never practice without being licensed and or certified. So for myself, I am state certified, nationally certified, and then have my medical massage practitioners. So going back to why I think this question is more important, especially in California. So California is still it's a polite way of saying this, a undocumented state. There's no regulation over massage therapy. We have the California Massage Council, but you do not have to be licensed or certified in California to practice massage therapy. It's recommended that you do, but there are therapists out there who have not finished the appropriate amount of hours and or education who are practicing. So yeah. So to answer the question, yes, you should always, always, always ask if the therapist you're going to see is certified. Question number 3 when shopping for a massage therapist. How long have you been practicing? Well, I think this question should be more detailed because, first off, you could have been practicing for a decade, but you're not licensed or certified. So does that really count as practicing? I'm not sure. Second, have you been practicing part-time, full-time? Did you take 5 years off and now you're saying you have 15 years experience because you've been practicing that long, but 5 years of that you weren't practicing? So I guess I don't really know if I agree with this question. I think that, yeah, I don't really know how I feel about this question. I have been practicing since 2008, and I've been licensed or certified since 2009. And during that time, I pretty much worked. So full-time for a massage therapist is about 15 to 20 clients a week. It's about 20 to 30 actual physical hours of massage. So yeah, I don't know how I feel about that question, but that would be your answer. Question number 4 when shopping for a massage therapist. What is the typical client you work with? I think a better question would be what, not typical client that you work with, but what do you prefer working with? Because I think that's where your passion comes out. I work on, such a wide range of clients, from 8-year-old baseball players to, people in their, mid 60s and 70s who are just trying to enjoy retirement. So what is really typical? Because none of us are typical, and each of our bodies is so different, and our situation is so different. We might have, some common ailments, but there's nothing typical about each and every one of us. So I guess what I prefer to work on, or what I really enjoy working on, are the clients who want to work with me, and make it a partnership. So I have a role and they have a role, and their role is they want to improve, whether it's pain management, or they're an athlete and they want to get better, or work harder, or have less injuries, or be less prone to injury, whether they work at a desk and they just want to feel better so they can actually make it to retirement and enjoy it, whether they are a weekend warrior, whoever they are. My typical kind of client is going to be the client who wants to work with me. They want their homework. They want their stretches. They want their strengthening exercises. They want to fix the way that they sit at their desk. They want to work on their posture in the car, or at home. So I would say that would be the client that I prefer working with, because it really is a team effort. I can only do so much, and if the client isn't gonna, listen or take advice or take recommendations, although my hands are very healing and I can work wonders, I can only do so much if the client is also not willing to help themselves on a daily basis. Because if I'm only seeing them once a week, maybe twice a month or once a month, there is a lot of hours in between that we are wreaking havoc on our bodies, that it needs help from the client, not just me. So that would be my preferred client, is someone who wants to make this a team effort and make some real progress. So the 5th question, last question, for this, that you should ask when shopping for a massage therapist, is what their philosophy is on massage therapy. For example, are they more Western in their approach to massage therapy? I typically find a Western approach is more medical, orthopedic, sports, that style, versus Eastern, which is much more chi and zen and reflexology. So first off, knowing what you think as a client, your approach and belief in massage therapy, and then also finding that right massage therapist for the type of style that you think you'll respond best to. So for myself, my philosophy, or my vision, or how I've created my practice, is taking the clinical side of massage therapy, the problems, whiplash, scar tissue work, sports therapy, stretching, muscle and tension relief, stress reduction, neuromuscular therapy, trigger point therapy. Taking all of those more Western style massage modalities, but putting them in a relaxing setting. So I worked for a lot of clinics, and the lights are bright, and you're laying right next to somebody else, and there's no privacy, and there is a level of release within the body if you can just relax. So I wanted to take the work, the clinical side, the nuts and bolts, and I wanted to mix it with the thing that we all need, the unwinding, the relaxation, the just letting go, or being in that safe place where you can let go. I found that has been very successful for me, mixing those two. So that is my philosophy on massage therapy. So I hope that people like it and continue liking it. So yay.